Sometimes in surgery, the most elegant solution isn't about cutting something out, but about cleverly rearranging what's already there. Today, we're diving into a perfect example of that philosophy, the Lord's plication technique. It's a minimally invasive procedure for a really common condition.
So, here's our roadmap. First, we'll get a handle on the problem itself. What is a hydrocele? Then we'll introduce the Lord's technique and see how it's different. After that, we'll walk through the actual surgery and really zoom in on the key step, which is called plication. And finally, we'll talk about what this all means for the patient and their recovery.
All right, so first things first. Before we can appreciate the solution, we've got to understand the problem it's designed to fix. So a hydrocele, in simple terms, is just a buildup of fluid. It happens inside a thin little sac that naturally surrounds the testicle. This sac is called the tunica vaginalis. This fluid collection causes swelling, and while it's usually not painful, it can definitely be uncomfortable, which is why people look for a fix.
Now, this is really important. The Lord's technique isn't a one-size-fits-all solution. It's specifically for what doctors call uncomplicated hydroceles. We're talking about cases where the swelling is small to medium and the wall of that fluid-filled sac is still thin and flexible.
Okay, so we've got the problem down. Now let's get to the really cool part, this elegant solution, the Lord's technique. This is where you can really see the ingenuity.
For a long time, the standard approach was, well, pretty aggressive. Surgeons would either just cut out the entire sac, that's called excision, or they'd flip it completely inside out and stitch it back on itself. The Lord's technique is a whole different ballgame. It avoids all that major cutting and flipping. Instead, it just focuses on simply folding the sac, all with very little disruption to the tissue around it.
So how does this minimalist approach actually play out in the operating room? Let's walk through the procedure, step by step.
The procedure starts simply enough. The patient is prepped and under anesthesia, but the key details pop up right away. The incision is small, and, this is crucial, the surgeon works on the sac without ever pulling it outside of the body. This idea of minimal tissue handling is absolutely central to the whole technique.
All right, next up, a tiny opening is made and the fluid is drained out. That immediately takes care of the swelling. Then comes the main event, plication, which we're going to break down in just a second. And finally, everything is closed back up. It's a very direct, very efficient process.
And that brings us to the core concept. This is the aha moment. This is the single step that truly defines the Lord's technique and changes everything.
So what is it really? What's the secret sauce that sets this procedure so far apart from those older, more traditional surgeries?
It all comes down to this. Nothing is cut out, nothing is flipped inside out. The sac that held all that fluid is left almost completely intact, and that dramatically reduces the trauma to the whole area.
So what on earth is plication? Honestly, the best way to picture it is like making a series of little tucks in a piece of fabric to make it smaller. The surgeon just gathers the now empty sac and uses a few absorbable stitches to fold it in on itself. This shrinks the sac down so it just can't collect fluid anymore. It's a simple and, frankly, brilliant mechanical fix.
Okay, so what does this much gentler approach actually mean for the patient? Let's talk about the payoff, right? The benefits and the recovery.
The advantages all flow from that one core principle. Because there's so much less cutting and messing with the tissue, you get far less bleeding. That means a much lower risk of a hematoma, which is a really painful collection of blood. And that directly leads to less pain after the surgery and, you guessed it, a significantly faster recovery.
So we're left with this really powerful idea. A simpler technique that respects the body's own anatomy leads to a better outcome. It really makes you wonder, doesn't it? Is this philosophy of minimal intervention, of solving problems with the smallest footprint possible, is that the future for all kinds of common surgery?